So good morning everyone. I will like to elaborate about this. This is the temporal bone. So how to hold this temporal bone? We can hold this temporal bone by placing the mastoid tip inferiorly. This is the mastoid tip, mastoid process inferiorly, and the zygomatic process of the temporal bone anteriorly and squamous part superiorly. So it consists of the following part. This is the squamous part of the temporal bone. This is the zygomatic process of the temporal bone. This is the mastoid process of the temporal bone. And in each of this, the styloid process is broken. And this is the petrous part of the temporal bone. This is the petrous part of the temporal bone. So this temporal bone consists of a squamous part, and this squamous part articulates with, like in this bone is on this squamous part articulates with the greater wing of the sphenoid, anteriorly with the greater wing of the sphenoid, and inside this petrous part, then this is the petrous part of the temporal bone articulates with the sphenoid bone and leads into a foramen known as the foramen lacerum, and posteriorly this is the petrous part articulates with the occipital part of the and clivus part of the occipital bone. And on its posterior part it leads into an, this is the jugular fossa. This is the jugular fossa known as jugular fossa. The gap is present. This is known as the jugular fossa. On the posterior part surface of the petrous part of temporal bone there is a groove is present. The groove is for the internal auditory canal, which is divided into the four parts by the Bill's bar and falciform crest. This is the arcuate eminence. And on the inferior surface of the petrous part of temporal bone there is a canal known as carotid canal, and this carotid canal passes anteromedially. This is the carotid canal. Now see how it is close to the eustachian tube. Here is the eustachian tube orifice, bony part of the eustachian tube, and when this bony parts comes out and this articulates with the sphenoid bone and leads into a fissure like known as the sulcus tubi, which contains the cartilaginous part of the eustachian tube. This is the external auditory meatus. This external auditory meatus is formed by the tympanic plate of the temporal bone, and this tympanic plate ongoing which forms the this tympanic plate from the anteroinferior floor and some posterior part of the external auditory canal, and this articulates with the petrous part of the temporal bone anteriorly to form the squamous part of the temporal bone anteriorly from the squamotympanic fissure, and this squamotympanic fissure in turn on going more anteriorly divided into two parts, petrosquamous and petrotympanic fissure, and through this petrotympanic fissure from the petrotympanic fissure the chorda tympani nerves enters the middle ear. So firstly there is the squamotympanic suture, squamous and tympanic, then the squamotympanic suture, and this further leads into the petrosquamous and petrotympanic fissure. And here is the stylomastoid canal is present through which the facial nerve comes out. This is the stylomastoid canal foramina. Through the facial nerve comes out, and in the after entering the parotid divides into the terminal branches. This is the mandibular fossa. Then there is a articular tubercle on the anterior surface on the mandibular fossa, and which is continuation with the tubercle on the tubercles on the greater wing of spinal tubercles. So the posterior limb, this petrous parts from the anterior border of the posterior cranial fossa along with the clivus. And this is the lodgement for the sigmoid sinus area. This is the transverse sinus area, occipital sinus, transverse sinus, superior petrosal sinus, inferior petrosal sinus. So the superior petrosal sinus drains into the transverse sinus, while the inferior petrosal sinus directly drains into the internal jugular vein, jugular fossa, for the bulb of the internal jugular vein. Thank you.